Uterine fibroids as an early signal for women's heart disease. Key points. Uterine fibroids could act as an early warning sign for heart disease in women. Women with fibroids have more than an 80% higher risk of developing heart disease. The risk is even higher for women under 40, reaching about 3.5 times greater likelihood. Wednesday, December 10, 2025, Health Day News. A new study suggests that uterine fibroids may serve as an early indicator of heart disease risk in women. According to researchers, women diagnosed with uterine fibroids show an 81% higher chance of experiencing heart disease over the following decade, a finding published in the Journal of the American Heart Association. Our results imply that fibroids could be an important marker for identifying women at elevated cardiovascular risk, with the increased risk persisting for up to 10 years after diagnosis, said lead researcher Julia Tosto, a doctoral student in epidemiology at the University of Pennsylvania. Fibroids are non-cancerous growths that arise from the uterus's muscular wall, according to background notes from the researchers. Estimates indicate that up to 20% of women, and perhaps as many as 80%, will develop fibroids by age 50. Approximately 26 million premenopausal women in the United States are affected by uterine fibroids, and many experience no symptoms, Tosto noted in a news release. Yet despite how common they are, fibroids remain under-researched and not well understood. Common symptoms include heavy or prolonged menstrual bleeding, bleeding between periods, and pelvic pain, as described by Johns Hopkins Medicine. For the study, investigators analyzed data from over 450,000 women with fibroids and compared them with about 2.2 million women without fibroids. The data spanned 2000 to 2022. The researchers looked to see whether fibroids were associated with higher rates of heart disease, stroke, or peripheral artery disease. After 10 years, roughly 5.4% of women with fibroids had a heart-related event, such as a heart attack or stroke, compared with 3% of those without fibroids. Overall, the presence of fibroids correlated with an 81% higher risk of developing heart disease over a decade. Notably, the youngest group studied, women under 40, exhibited the strongest association, with a 3.5-fold higher risk of heart disease for those with fibroids compared with those without. The strength of the association between heart disease risk and uterine fibroids is striking, Tosto commented. However, further research is needed to confirm these findings in different populations before we consider formal changes to cardiovascular risk assessment guidelines. Possible reasons for the link include shared biological pathways observed in some studies, such as the growth of smooth muscle cells, excessive fibrous tissue buildup, calcification, and inflammatory responses. Dr. Stacy Rosen, volunteer president of the American Heart Association, commented on the findings. This study highlights another aspect of how women face unique factors when it comes to cardiovascular disease, the leading cause of death for them. It also underscores the critical role that all of a woman's healthcare providers can play in her overall health, including heart health. Rosen was not involved in the study. What this means for you. Women with uterine fibroids should talk with their healthcare provider about potential heart disease risk and strategies to reduce that risk through lifestyle changes such as a balanced diet, regular physical activity, and maintaining a healthy weight. Further information. Johns Hopkins Medicine offers additional information on uterine fibroids and related health topics. Source: American Heart Association, news release, December 10, 2025.